I am AQIB Hussain from National Academy PCR. In previous lectures, we covered the element number 1 of NEBOSH IGC course. So now we are starting element number 2. So in this, the main topic of this element is how health and safety management systems work and how they look like. So we will by element 2. 1. In this topic, we'll be covering an essential part of workplace safety, occupational health and safety management systems, OHSMS. These systems help organizations manage health and safety risks efficiently. Whether you're an employer or an employee, understanding how these systems work is vital. So let's dive in. So first of all, what is an OHSMS? An occupational health and safety management system, OHSMS, is a structured approach for managing health and safety risks in the workplace. It's designed to protect employees, meet legal requirements, and drive continuous improvement in health and safety practices. Now let's explain PDCA, the PDCA cycle. The foundation of any OHSMS is the PDCA cycle, which stands for plan, do, check, and act. Let's break down what each phase means. 1. Plan. In this phase, organizations develop a clear plan for how they will manage health and safety. This includes identifying risks and setting objectives. 2. Do. Here, the organization implements the plan. This is where the actual work takes place, carrying out risk assessments, providing training, and ensuring safety measures are in place. 3. Check. The organization then needs to check whether the plan is working. This could involve monitoring performance, conducting audits, or reviewing incident reports. 4. Act. If there are any gaps or areas for improvement, the organization takes corrective actions to enhance the system. This step leads to continuous improvement, ensuring the system evolves and improves over time. Evaluating the system. To ensure that the OHSMS is effective, regular evaluation is essential. There are a few key methods used: monitoring and reviewing. Organizations must monitor safety performance and regularly review their safety arrangements to ensure they're working as intended. Audit. An audit is an independent, systematic review of the management system. It's critical for identifying strengths, weaknesses, and areas for improvement. Action for improvement. Based on the results of the review or audit, the organization takes steps to correct any identified issues. This could involve changing procedures, updating policies, or providing additional training. Continual improvement. A great OHSMS doesn't remain static. It continually improves over time. By reviewing performance, auditing the system, and making changes where necessary, the organization can enhance safety standards and adapt to new challenges. Now let's talk about the ILO OHS 2001 framework. One well-known model for an effective health and safety management system is the ILO OHS 2001. This is the International Labor Organization's framework for occupational health and safety management systems. It provides clear guidelines for organizations to follow, and it's built around 4 key pillars. 1. Policy. The organization must have a clear statement of commitment to health and safety. This policy sets the tone for the company's approach to managing risks. 2. Organizing. Effective health and safety management requires clear roles and responsibilities. Everyone in the organization, from top management to workers, needs to know their role in ensuring a safe workplace. 3. Planning and implementing. This pillar involves putting detailed arrangements in place to manage health and safety risks. The cornerstone of this phase is risk assessments, which help identify hazards and control risks. 4. Evaluation and action for improvement. Organizations must evaluate how well their systems are performing and take action to address any shortcomings. Risk assessments. Risk assessments are a vital part of any health and safety management system. They help to identify potential hazards and determine the best way to control those risks. By regularly conducting risk assessments, organizations can reduce the likelihood of accidents and ensure a safer working environment. So, occupational health and safety management systems are critical for protecting employees and ensuring a safe workplace. Through the PDCA cycle, regular evaluations, and continuous improvement, organizations can effectively manage health and safety risks. The ILO OSH 2001 framework provides an excellent guide for implementing these systems, ensuring that health and safety remains a priority at every level of the organization. Hope you understand. So now move the next and very important topic, making the management system work, the health and safety policy. In this topic, we'll be exploring one of the core elements of an effective health and safety management system, the health and safety policy. This document is often called the foundation stone for good health and safety management. Let's break it down and understand its components and importance. So let's start from the introduction to health and safety policies. An effective health and safety policy is crucial for every organization. It clearly sets out the organization's aims related to health and safety, who is responsible for achieving these aims, or how these aims will be achieved. This policy is specific to each organization, reflecting its unique circumstances and risks. It's also required by law in many countries, as recommended by ILO Recommendation R164, which asks employers to provide written policies and arrangements for health and safety management where circumstances warrant it. The policy should always be communicated in a readily understood language or medium to ensure everyone knows what's expected. The next topic we have, the 3 parts of a health and safety policy. The health and safety policy typically has 3 key sections. 1. Statement of intent. This section outlines what the organization is going to do. It defines the overall aims and objectives, ensures compliance with the law, and is often signed and dated by the most senior person in the organization. 2. Organization or organizing. This section identifies who is responsible for managing health and safety. It defines the roles and responsibilities of staff, management, and safety professionals within the company. 3. And the third one is arrangement section. This part explains how the organization will achieve its health and safety goals. It covers risk assessments, safety procedures, training, and emergency planning. Let's break down. So the first one is general statement of intent. The general statement of intent is a high-level overview of the organization's commitment to health and safety. It sets overall aims and objectives, ensures legal compliance, and aims to achieve high safety standards. It also reminds workers at all levels of their responsibilities and emphasizes that health and safety are the top priority. Now, what is meant by setting SMART objectives? When setting health and safety objectives, organizations should use the SMART criteria: specific, clearly defined, and precise objectives. Measurable targets should be quantifiable and trackable. Achievable. The objectives should be realistic and possible to achieve. Reasonable, within a realistic time frame and budget. Time-bound. There should be a clear deadline for achieving the objective. For example, an objective like review all 48 risk assessments within a 12-month period is a SMART goal. While setting these objectives, organizations should consider several factors, including who is responsible for setting objectives, how objectives will be set at each functional level, legal requirements, hazards, risks, and the views of interested parties. Now move to the next topic, which is organizational roles and responsibilities. A well-defined health and safety policy outlines the chain of command for health and safety management. It includes the CEO or managing director, who is ultimately responsible and accountable for health and safety. Management, who handle day-to-day operations and safety compliance. All employees, who are responsible for working safely and reporting hazards. Competent persons, such as first aiders and fire marshals, who have specific safety responsibilities. Specialist health and safety practitioners, who provide advice and support. This structure is often visually represented in an organizational chart, showing clear lines of communication and responsibility. Now, move to the arrangements for health and safety. The arrangements section of the policy outlines the specific steps the organization will take to manage health and safety. General topics include carrying out risk assessments, providing information, instruction and training, accident and near-miss reporting, consulting with workers about health and safety concerns, developing and maintaining safe systems of work, ensuring adequate welfare provisions and first aid facilities, fire safety and prevention, emergency procedures for handling incidents, compliance monitoring, such as audits to ensure safety measures are in place. In addition to these general topics, the arrangement section should address specific risks related to the organization's work, such as lone working, noise and vibration exposure control, toxic material handling, crowd control, transport risks, health surveillance requirements, waste disposal, review and improvement of the policy. An effective health and safety policy is a living document. It must be regularly reviewed and updated to stay relevant. Key reasons to review a policy include changes in key personnel or management structure, updates in processes, technology, or legislation, not following a significant incident or enforcement action, after an audit or worker consultation, or simply as a matter of routine, such as an annual review. Reviewing the policy ensures that the organization remains compliant with the legal requirements and continues to protect its workers effectively. How to communicate the policy effectively. To be effective, the health and safety policy must be well communicated. This can be done through staff meetings and training sessions, posters and notice boards, emails and company newsletters. The goal is to ensure that every employee, from the top of the organization down to the frontline workers, understands their role in keeping the workplace safe. So, a well-crafted health and safety policy is crucial for managing risks and protecting employees. It must be tailored to the organization's specific needs, clearly communicate responsibilities, and be regularly reviewed to stay relevant. Okay, this is the end of element number 2. In next video, we will element number 3 of this course. So thanks for watching this video. Don't forget to like, share, and subscribe for more information. Good luck and goodbye.